Hi, I'm Drew Merefield, and today I'll be talking about the Yang Ming. Included in the Yang Ming is Bell's palsy. Bell's palsy affects 20 to 30 out of every 100,000 people in the world. It is the muscle weakness on one side of the face, and this can be caused by other medical factors. So if we look at stroke versus Bell's palsy in this diagram here, we can see that there is a lesion inside the brain, and that has caused damage to the lower motor or facial nerve and not the upper. Whereas the diagram on the left, that is compression or inflammation within the fallopian canal in the face, which both the upper and lower nerve pass through. There we can differentiate between those disorders. Tong from Hong Kong says, during Bell's palsy, there is acute demyelinization and acute inflammation all the way along the nerve. So now I want to go back to Merefield and Baldry. So what they did was expose the brain, and they put electrodes in, and then with each experiment they had a letter or a number, and they wrote down which part of the body they got movement from. Accordingly, they got a little square of paper with the letter or the number on it, and they put it at that part of the brain. Hence, they managed to map the brain, and from this, it forms a representational map of the body, the cortical homunculus, drawn on the brain. The top left corner here, we can see a foot at the apex of the head, or around 220. And then we can see a face protruding from the side of the head above the ear. If we were to make a sculpture out of it, this is the sculpture that we get. The over-exaggerated hands and face telling us how much of the brain surface are linked to motor and sensory functions of the hands and face, as opposed to the rest of the body. When we get facial palsy, what actually happens is there's an area of the brain that is linked to the face. However, the afferents is not getting in touch with this part of the brain. And Lee, from his research, found that when this happens, the area that controls the hand becomes bigger and it takes over the facial area. He calls this cortical reorganization. Now, what that tells us for Chinese medicine, it really puts a link between scalp acupuncture, distal point acupuncture, or Korean hand acupuncture being beneficial. Terry Olson's diagram link the auricular acupuncture to how it works through the nerve system. We have the earbuds of an embryo on the left there. They actually develop into the facial nerve. Dr. Cohen talks about operation centers as the body develops. You might have an operation center at the knee, at the elbow. That operation center is in charge of creating the rest of that limb. Now, Kak makes research on the nucleus tractus solitari here. We can see that at the base of the brain, there is a neural junction that is in charge of the afferents for our nerves. The link here, we look at acupuncture on the body, is going to go through this neural junction, and therefore it's going to get to our disorders in the body and change the neurochemicals that are being emitted in these places, thus affecting inflammation through the secretion of different neurochemicals. Chen has another study where he's shown acupuncture increases nerve regeneration from ischemic damage. Looking at Chinese herbal medicine, we can look at examination of tissue after somebody has taken it. It's found to have the pharmacoconstituents actually in that tissue. Gong has looked at the use of Da Chen Qi Tang and acute pancreatitis. He's related acute pancreatitis to Yang Ming, Fu Shi syndrome. So basically we have an excess in the Yang Ming. Bell's palsy was channel pathology, whereas this is internal pathology. He states that Da Chen Qi Tang is being used to treat Yang Ming, Fu Shi syndrome in the last more than 300 years in China. We're looking at those disorders from a Western diagnosis, also from a Chinese medical diagnosis. We have the patent conditions of Yang Ming Fu Shi or Yang Ming Channel Shi, and reducing those in different methods of Chinese medicine. But the real thing that we should be focused on here is, in Chinese medicine, it's very hard to see the inflammation in a facial nerve. It's very hard to see that it's the pancreas that has the acute inflammation. So the relationship between Western medicine and Chinese medicine, really one can look at using Western medicine with its amazing ability to look inside the body with magnetic imaging resonance and x-rays and ultrasound and serum tests, and using that to our great advantage to see exactly what the disorder is. And then using our Chinese medicine, which has been demonstrated to work on a Western science understanding to treat these Western medical pathologies, which Zheng Zhongjing did, just without the Western science.